Hi, welcome to OSHA training for healthcare and dentistry. I know a lot of you have been through this before and understand that most of these concepts come down to common sense. But if this is your first time sitting through OSHA training, you might be wondering, what's OSHA and why should I care?
OSHA stands for the Occupational Safety and Health Administration, the federal agency responsible for regulating and enforcing workplace safety standards. Their mission is simple: to ensure that each employee has a safe and healthy workplace. This is your OSHA manual. This manual, or one like it, outlines your facility's safety protocols. These policies include your bloodborne exposure control plan, hazard communications, medical waste management, and other policies related to employee safety. You have the right to access this book anytime during business hours. Your safety matters, and by adhering to OSHA standards, you're helping to protect yourself, your coworkers, and your patients.
One thing is for sure, it doesn't matter if you're a healthcare provider, an assistant, or an administrative employee, maintaining a safe workplace is everyone's responsibility.
This is your federal OSHA poster. You should have it or your state's equivalent posted somewhere in your facility. It's a summary of the Occupational Safety and Health Act of 1970, and it conveys your rights and your employer's responsibilities. Fun fact: yes, your employer has the obligation to provide a safe workplace, but you have an obligation as well, and that's to follow their safety policies and report any safety concerns to your safety and health officer. Although two of the most obvious standards in healthcare are the Bloodborne Pathogen Standard and the Hazard Communication Standard, there are a bunch of regulations and requirements to keep you safe, including the broad category that we refer to as general workplace safety. General workplace safety includes your contingency plans for natural disasters, fires, violence in the workplace, and other hazards not generally covered by one specific standard. Natural disasters can strike at any time and in any location. Some, like hurricanes and blizzards, are seasonal and often provide time for preparation, while others, like earthquakes and tornadoes, can occur suddenly and without warning. For predictable disasters, like hurricanes or blizzards, advanced planning is key. These situations may allow for temporary closures, adjustments to business hours, or additional safety precautions to protect employees. Clear communications of these changes is essential so you know when and how to take action. Every year, thousands of workplace fires are reported, causing hundreds of deaths and substantially more injuries. The best way to avoid becoming a statistic is to be prepared. If you see fire or smoke, immediately activate the nearest fire alarm and call 911. Your primary course of action is to evacuate the building promptly. You should be familiar with the locations of stairwells and exits. Choose the safest and most direct route. Obviously, if you can safely assist others while evacuating, you should. But if you're scared or you doubt your abilities at any time, evacuate immediately. Don't attempt to retrieve personal belongings or try to fight the fire unless you're trained to do so. But if you have to, and you can do it safely, fire extinguishers can be really effective against small fires. Most fire extinguishers operate using the pass method. Pull the pin, which also breaks the tamper seal. Aim low, pointing the nozzle at the base of the fire. Squeeze the handle to release the extinguishing agent. Sweep the nozzle from side to side, covering the base of the fire until it's extinguished. Remember, OSHA prioritizes employee safety above all else. If you have any doubts about your ability to safely fight a fire, evacuate immediately. Your safety is the top priority. Workplace violence in healthcare is a real and growing concern. It includes any act of aggression, threats, harassment, or physical violence that occurs in the workplace. Healthcare settings are particularly vulnerable because employees often work in high-stress environments and interact with patients, families, and visitors who may be under emotional or physical distress. Being prepared and proactive is essential to ensure the safety of everyone. Let's review the key elements of preventing workplace violence and maintaining a safe environment. To prevent such situations, it's important to identify early warning signs such as raised voices, threatening gestures, or hostile body language and take steps to de-escalate it. When you're dealing with a tense situation, stay calm and speak in a steady, reassuring voice. Listen closely to the other person's concerns, acknowledge their feelings, and avoid interrupting them. Keep a respectful distance to prevent further tension, and whenever possible, offer realistic options that address their worries. If this is ineffective and the individual does not seem dangerous, calm and firmly set limits. Ask the individual to stop the behavior and warn of official action. Know when to exit. If the situation continues to escalate, remove yourself from harm and call for assistance. If you need to speak with someone who seems dangerous, avoid being alone by ensuring coworkers are nearby. Stay calm and non-confrontational, and never try to remove them yourself. Even a gentle touch could be perceived as a violation of their space. Keep in mind that each situation is different. Don't mention the police if you think it might provoke anger or violence. And always, if you have any concern for your safety, don't hesitate to call 911. In the unlikely event of an active shooter, it's important to remain calm, act quickly, and follow your safety protocols. The first step is to always be aware of your surroundings. Knowing the layout of the building, including exits and potential hiding spots, can make a huge difference in an emergency. When there's an active shooter situation, remember the run, hide, fight strategy. You run if there is a clear and safe escape path, leaving all belongings behind, help others escape if possible, and prevent others from entering the danger zone. Don't stop until you are far enough away to ensure your safety, and then call 911 to provide information about the situation, including the shooter's location, description, and the type of weapon involved if known. If escape isn't possible, the next best option is to hide. Find a location out of the shooter's view, preferably behind locked doors or heavy furniture that can act as a barrier. Silence your phone, turn off any sources of noise, and remain quiet. Ensure that you don't block yourself in a position with no exit. Remember, the goal is to stay out of sight and to create as many barriers as possible between yourself and the shooter. As a last resort, when your life is in imminent danger, you may need to fight. This should be done with full commitment and aggression, using any object at your disposal as improvised weapons. Act as a team if you're with others and aim to disarm or incapacitate the shooter to create an opportunity to escape or subdue them until authorities arrive. To minimize the risks associated with occupational exposure to bloodborne pathogens, your employer has implemented an exposure control plan as part of your OSHA policies. This plan outlines the procedures you perform and specifies the personal protective equipment and safeguards necessary to ensure your safety. According to OSHA's Bloodborne Pathogen Standard, your employer is required to provide training, offer hepatitis B vaccinations, supply appropriate PPE, and establish engineering and work practice controls to protect you. But what exactly are bloodborne pathogens? Bloodborne pathogens are microorganisms found in human blood and certain other bodily fluids. Examples include hepatitis B, hepatitis C, and HIV. Human immunodeficiency virus, or HIV, is a virus that attacks the immune system, the body's natural defense system. Without a strong immune system, the body has trouble fighting off disease. Both the virus and the infection it causes are called HIV. While HIV poses a potential risk to healthcare workers, it's primarily a sexually transmitted disease. The highest risk groups include individuals with multiple sexual partners and injecting drug users who share needles. In healthcare settings, the main modes of transmission are needle-stick injuries or cuts from contaminated sharp objects. Direct contact with blood or bodily fluids through mucous membranes or non-antic skin is also a recognized route of transmission. HIV is a slow-progressing virus that remains present in the body throughout every stage of the disease. The progression typically occurs in 3 stages. The first is the initial stage of infection, the second is the chronic asymptomatic stage, and the third is the symptomatic stage, commonly referred to as AIDS. HIV might not cause noticeable symptoms in its early stages. When symptoms do appear, they are often mistaken for the flu or mono. This initial stage of infection occurs within weeks of acquiring the virus. Common symptoms include flu-like symptoms, fever, diarrhea, fatigue, rash, joint pains, swollen lymph glands. These flu-like symptoms usually subside after a few weeks. The next step is chronic asymptomatic infection. During this stage, the individual appears healthy and may not exhibit symptoms. However, they're still HIV positive and can transmit the virus to others. This phase can last for several years. The final stage is symptomatic infection known as acquired immunodeficiency syndrome, or AIDS. By this point, the immune system has been largely weakened due to the depletion of essential immune cells caused by the virus. As a result, the individual becomes highly susceptible to opportunistic infections like pneumonia and certain types of cancers. Understanding these stages and how the virus is transmitted is crucial for managing the risks in healthcare settings. The term hepatitis means inflammation of the liver. While various factors, such as alcoholism, can cause liver inflammation, this discussion will focus specifically on viral hepatitis. Viral hepatitis includes 5 types: hepatitis A, B, C, D, and E. Hepatitis A and E are typically transmitted through contaminated food or water. Hepatitis D, often called a piggyback virus, can only infect individuals already carrying hepatitis B, increasing the severity of acute and chronic liver disease. Hepatitis B and C, however, are bloodborne diseases and pose a particular risk to healthcare workers. Let's explore these types in more detail. The virus is transmitted through contact with blood and bodily fluids of an infected person. In most adults, hepatitis B is a short-term illness known as acute hepatitis B, where individuals recover fully. However, in some cases, the infection becomes long-term, leading to chronic hepatitis B, which can cause severe liver damage over time. One of the challenges with hepatitis B is that you can have the virus without realizing it, as many people experience no symptoms. For those who do show symptoms, they may resemble the flu and include extreme fatigue, mild fever, headache, loss of appetite, nausea or vomiting, abdominal pain, tan-colored stool, dark urine, and jaundice. It's important to note that jaundice usually appears late in the illness. Additionally, most people with chronic hepatitis B don't exhibit any symptoms at all. Although hepatitis B is a serious risk for healthcare workers, the good news is that it can be prevented effectively through vaccination for most individuals. Employers must provide the hepatitis B vaccination at no cost to employees at risk of exposure to blood or other infectious materials. If you haven't been previously vaccinated and are at risk, your employer is required to offer it to you free of charge. The hepatitis B vaccination is administered in the deltoid muscle as a series of 3 doses over a 6-month period. According to CDC guidelines, healthcare workers should have a titer taken 1 to 2 months after that final dose to confirm the presence of proactive antibodies. While the vaccine is highly effective, up to 10% of individuals may not develop antibodies. For individuals who do not respond to the initial vaccination series, known as non-responders, the CDC recommends repeating the 3-dose series. After completing the second series, another blood test is conducted to check for antibody development. If no antibodies are detected after this second series, a total of 6 doses, the individual is confirmed as a non-responder. Non-responders will not develop immunity to hepatitis B. However, knowing your status is critical for managing your risks and taking appropriate precautions, rather than assuming you are protected. If you were vaccinated as an infant, a student, in the military, or in some other capacity other than a healthcare worker, you probably developed immunity but never had confirmation from a titer check. It's not your employer's responsibility to revaccinate you or provide the titer. However, following a needle stick injury or an exposure incident, you would be tested for all 3, Hep B, Hep C, and HIV, where someone that was vaccinated, had a titer, and confirmed that they had immunity to hepatitis B would only be tested for Hep C and HIV. If you're at risk or have questions about your facility's policy on hepatitis B vaccinations, speak with your safety and health officer for further guidance. Hepatitis C is a viral infection that causes inflammation of the liver and, if left untreated, can lead to serious liver damage, including cirrhosis, liver failure, or liver cancer. Unlike hepatitis B, there is no vaccine for hepatitis C, making prevention and adherence to your safety protocols even more important. The symptoms are very similar to hepatitis B. Most people have no symptoms when they're first infected. If symptoms are present, they may include feeling very tired, joint pain, belly pain, itchy skin, sore muscles, dark urine, and jaundice. Most people go on to develop chronic hepatitis C, but still don't have symptoms. This makes it common for people to have hepatitis C for decades before it's diagnosed. Universal precautions are an essential infection control practice where all blood and certain human bodily fluids are treated as if they're known to be infectious. In simpler terms, it means treating every patient as though they could carry a bloodborne disease regardless of their health history or appearance. While some patients may disclose that they have a bloodborne disease, it's important to remember that many individuals may not know they're infected or may choose not to share this information due to the fear of discrimination or stigma. Universal precautions eliminate the guesswork, ensuring that all patients are treated with the same level of safety regardless of who they are. Personal protective equipment, or PPE, refers to specialized clothing or gear designed to create a protective barrier against blood and other potentially infectious materials. It plays a crucial role in safeguarding you and your coworkers from exposure to bloodborne pathogens. Your employer is responsible for providing appropriate PPE at no cost to you. This includes that it's readily available, easily accessible, and properly fitted. Additionally, accommodations must be made for individual needs, such as offering latex-free alternatives for those with allergies. So what does PPE include?
It covers a wide range of protective items, including
gloves, masks, eye protection, barrier garments. In other words, PPE includes equipment required to safeguard you from potential exposure to bloodborne pathogens. Every facility's risks of exposure varies depending on the procedures performed. Your safety and health officer has carefully assessed these risks and determined the minimum required PPE for the tasks at your facility. You can find this schedule of minimum required PPE in the exposure control section of your Red OSHA Guard manual. This schedule outlines the specific personal protective equipment necessary for the tasks you perform. The reality is that personal protective equipment is your first line of defense against bloodborne pathogens and other infectious materials. By understanding and following your facility's PPE protocols, you can significantly reduce your risks of exposure while maintaining a safe environment for yourself and others. Proper cleaning and disinfection are essential in preventing exposure to blood and other infectious materials in healthcare settings. Using the right disinfectants and using them correctly is a critical step in maintaining a safe environment.
disinfectants in medical and dental facilities must effectively kill harmful bacteria and eliminate fungi. Products that meet both these requirements are referred to as hospital-grade disinfectants. To ensure optimal use, it's important to follow the manufacturer's instructions, which outline the appropriate contact time and application methods.
Engineering controls are measures designed to isolate or remove workplace hazards, including those that reduce the risk of needle stick injuries. The Bloodborne Pathogen Standard was revised in 2003 to require the use of safer medical devices, such as sharps with engineered injury protections and needleless systems, whenever feasible. These devices are designed to minimize exposure risks and include syringes with sliding sheaths that shield the needles after use, needles that retract into the syringe after use, shielded or retracting catheters, retractable safety scalpels, needleless systems for fluid collection or medication administration. The use of these safer alternatives must be evaluated annually and implemented if appropriate. Employees who handle needles, including those who administer injections or dispose of sharps, should participate in the evaluation process. Key considerations when selecting a safe device include ease of use, effectiveness, and minimal patient discomfort. To assist with evaluations, you'll find a safe needle evaluation form in the back of your OSHA Guard manual. This form includes questions such as, can the safety feature be activated with one hand? Is the device easy to handle while wearing gloves? Does the safety feature cause more patient discomfort? Document all evaluations, and if you choose not to use a device, explain why it's not suitable.
Safety needles can significantly reduce the risk of exposure incidents, but they aren't always appropriate for every procedure or specialty. In situations where safety needles are unavailable or unsuitable, it's important to implement other engineering and work practice controls to minimize exposure hazards. Whenever possible, avoid recapping needles. If recapping is necessary, use a mechanical recapping device to keep your hands clear of the needle. Sharps should be discarded immediately after use into designated sharps containers, and disposable needles, syringes, and blades should never be left exposed. Reusable sharps must be placed in puncture-resistant, leak-proof containers labeled as biohazardous until they can be properly sterilized.
By implementing the use of engineering controls, work practice controls, and safety needles, if appropriate, you can significantly reduce the risk of needle stick injuries and protect yourself and your coworkers from bloodborne pathogens. While we've covered strategies to minimize the risk of exposure to bloodborne pathogens, it's important to remember that accidents can still occur. If you experience an exposure incident, it's critical to act quickly and follow the proper protocols to ensure your safety and well-being. If you have an exposure incident, you have the right to immediate medical attention. Any exposure incident should be reported to your safety and health officer as soon as possible. These forms are used to document exposures or sharps injuries in your workplace. They should be completed as soon as possible after an exposure incident. These forms are important. They document the exposure, allowing management to implement changes if necessary to avoid a similar accident in the future, but it also provides permanent documentation in your employee medical record in case there are complications down the road. Your employer also has the legal obligation to ask the source patient, if known, to consent to a blood test. Ideally, both the exposed employee and the source get tested. If the source patient's blood comes back negative, that's the extent of testing, and the employee has closure and peace of mind, usually within 15 days. If the source is unknown or refuses to test, testing is normally carried out over a 6-month period. This normally includes the baseline and any follow-up testing. OSHA currently enforces the CDC's recommendations for post-exposure prophylaxis. If you have any questions about the process or need assistance, don't hesitate to reach out to your safety and health officer.
On May 11, 2023, the U.S. officially ended the COVID-19 national public health emergency. OSHA finally closed their book on their permanent COVID rule effort on January 15, 2025. They are choosing to focus their efforts on a broader infectious disease standard.
While the Bloodborne pathogen standard has been highly effective in protecting healthcare workers, it doesn't cover infectious diseases transmitted through other routes such as contact, droplet, and airborne transmission. Traditionally, infectious respiratory disease transmission has been classified as droplet or airborne. Droplet transmission occurs when large respiratory particles from talking or coughing contact another person's eyes, nose, or mouth, usually within 3 to 6 feet. These particles don't remain suspended in air or require inhalation for infection. Airborne transmission has been thought to involve only tiny particles that travel long distances through ventilation systems or other large spaces. Today, we know that particles vary in size and can remain suspended indoors for long periods, making inhalation the primary route of transmission. Rather than distinguishing between droplet and airborne, the term aerosol-transmitted diseases, or ATDs, was adopted. Fortunately, most medical and dental facilities don't admit or treat patients exhibiting symptoms of an upper respiratory infection or an ATD, but it's still possible asymptomatic patients or patients exhibiting less symptoms might be seen. In consideration, all healthcare facilities should follow standard and transmission-based precautions to prevent or reduce workplace infections. Early identification of sick patients or employees, appropriate personal protective equipment, proper hand hygiene, engineering and work practice controls, surface disinfection, employee training, and other controls help reduce the risk of transmission of infectious agents to employees. In healthcare facilities that treat infectious patients or high-risk settings, addressing infectious diseases is challenging because of their diverse and unpredictable nature. As a result, not all workers within the same facility, not all individuals with the same job title, and not all healthcare facilities face the same level of risk. If you have a job that requires you to wear specialized PPE, like wearing an N95 respirator, your safety and health officer can provide information on fit testing if it's required and any additional training to perform your job safely. OSHA defines a hazardous chemical as any element, chemical compound, or mixture that poses a physical or health hazard. To ensure that employees are informed about these risks, OSHA established the Hazard Communication Standard. This standard requires that information about hazardous chemicals and the necessary protective measures be clearly communicated through labeling, safety data sheets, and employee training. Nearly every healthcare or dental facility contains chemicals that could be potentially dangerous if not handled properly. Cold sterile solutions, disinfectants, and lab chemicals are just a few examples of substances you may encounter that require careful handling.
Under OSHA's Hazard Communication Standard, your employer is required to develop and maintain a written hazard communication plan, ensure that all hazardous chemicals are properly labeled, especially when they're transferred from their original containers, provide safety data sheets or SDSs for every chemical and professional product used in your workplace, and train employees in the safe use, storage, and disposal of hazardous chemicals.
You can find your facility's hazard communication plan in your red OSHA Guard manual or alongside your OSHA policies. This plan shows how hazard communication compliance is achieved in your workplace. This hazard rating chart, or one like it, should be displayed in your facility. It explains the fundamentals of and the rating system used by the Hazard Communication Standard, aligned with the Globally Harmonized System of Classification, or GHS. This chart provides an overview of the 9 pictograms used to convey hazards under GHS, a summary of the information found on a safety data sheet, and the standards for secondary container labeling. Prior to the Hazard Communication Standard aligning with GHS, manufacturers use the NFPA or HMIS rating systems. These systems use colors and numbers to identify the type and severity of specific chemical hazards. Now, more information is required, but is conveyed in a way that's much easier to understand. Chemical hazards are now identified through a combination of information, including pictograms and hazard and precautionary statements. Pictograms are standardized symbols used to identify a distinct physical or health hazard associated with a chemical or substance. Each pictogram consists of a symbol on a white background framed within a red border. Flame, exclamation point, skull and crossbones, health hazard, corrosion, gas cylinder, flame over circle, exploding bomb, environment. Safety data sheets, or SDSs, formerly known as Material Safety Data Sheets, or MSDSs, are documents that are required by OSHA that provide detailed information about the property, hazards, handling, storage, and disposal of the chemicals used in your workplace. Make sure SDSs are available for all the products you use. It's okay to have them in a binder or kept electronic, but they need to be easily accessible, and employees need to know where and how to access them. If you need to get SDSs, the manufacturers and their distributors, your medical and dental supply companies, have an obligation to provide them. So if you order from Shine or McKesson or someone like that, request them from your representative or try a keyword search on the internet. Most SDSs are provided by the manufacturer online. Each SDS includes information like identification, hazard identification, composition information on ingredients, first aid measures, firefighting measures, accidental release measures, handling and storage, exposure controls and personal protection, physical and chemical properties, toxicological information. There are 16 sections in total, and the structure is standardized to make it easy for you to quickly find the product information you need.
Here's a fun fact. You could stop using a product tomorrow, and OSHA would expect you to keep the SDS for 30 years after stopping its use in your workplace. They consider safety data sheets to be part of your employee medical record.
Secondary container labeling applies to chemical products that you remove or transfer from their original container. In healthcare, products like cold sterilant, ultrasonic tablets or solution, surface disinfectants, and lab chemicals are often transferred to different containers. Make sure these secondary containers are identified and include the product's name, pictograms, and appropriate hazard and precautionary statements. Use the original packaging or reference the product's SDS sheet to find the hazards and precautionary details. Labels should be legible and prominently displayed on the container or in the immediate work area. It's okay to use placards or the backsplash, just be sure that it's near your container. This label on this bottle correctly identifies the contents as isopropyl alcohol. It includes the manufacturer's name and provides the appropriate warnings. Since the manufacturer's container is adequately labeled, no further actions are required. But if the alcohol is transferred into a secondary container, it's important to label that container to identify its contents and the applicable warnings.
Regulated waste, also known as medical, infectious, or biomedical waste, can pose a risk of infection to humans. No matter what it's called, the top priority is handling it safely. While OSHA provides guidance on the safe handling of this waste, most disposal rules are set by your individual state. OSHA's focus is mainly on how regulated waste is separated and managed at the point of origin and where it's disposed of in your facility.
Under OSHA's Bloodborne Pathogen Standard, and in alignment with most states' definitions, regulated waste includes liquid or semi-liquid blood or other potentially infectious materials, contaminated items that would release blood or other potentially infectious materials in a liquid or semi-liquid state if compressed, items caked with dried blood or OPIM capable of releasing these materials during handling, contaminated sharps, and pathological and microbiological waste containing blood or other potentially infectious materials. OSHA requires contaminated sharps to be discarded into approved sharps containers at the point of origin or as close as possible to where the waste is generated. These containers must be closable, puncture-resistant, leak-proof on the bottom and sides, and labeled or color-coded with a biohazard symbol as per the standard. Sharps containers are intended for spent needles, carpules, blades, glass slides, or any other sharp item contaminated with blood or other potentially infectious materials. Proper assembly is crucial. Securely fasten the lids and ensure the opening is orientated correctly. Keep the biohazard symbol visible and the fill line visible. If wall-mounted, anchor the container firmly at a comfortable height for all users. Never exceed the designated fill line on a sharps container. When the contents approach this line, seal and replace the container immediately at the point of origin. The full container should be then moved to your final storage area or disposed of during the next scheduled pickup. For regulated waste not classified as sharps or soft waste, use red bags. These red biohazard bags are specifically designed to be leak-resistant, tear-resistant, and puncture-resistant, and they display a biohazard symbol. Like sharps containers, red bags should be easily accessible and located where the waste is generated. Red bag waste commonly includes soft items saturated with blood or other potentially infectious materials, regardless if they are absorbent or not. These items include gauze, dressings and cotton rolls, visibly contaminated gloves, IV tubing. By following these guidelines, you ensure that biomedical waste is handled, stored, and disposed of safely and in compliance with OSHA, federal, and state regulations. Although it's somewhat unlikely, blood spills can happen in almost any healthcare facility. Proper cleanup is necessary to protect you, your coworkers, and your patients from exposure to bloodborne pathogens. Here are steps to safely and effectively clean up a blood spill. Before tackling any blood spill, always wear the appropriate PPE. This would include gloves for most situations, but if it's a large spill, consider a gown or apron. If there's a chance of splattering or splashing, wearing a face shield or eye protection. Secure the area to prevent further contamination. Apply an EPA-registered disinfectant or a 1 to 10 bleach solution to the affected area. Allow the disinfectant to sit for at least 10 minutes to kill pathogens. If there are sharps present or contaminated broken glass, use tongs or a dustpan to place them in a sharps container. Use absorbent materials like paper towels or spill pads to soak up the blood. Dispose of these used materials immediately into a red biohazard waste bag. Wipe the area clean using disposable towels. Dispose of all contaminated absorbent materials and PPE into a red bag. Wash your hands thoroughly with soap and water, and finally, report the spill and cleanup to your safety and health officer.
Well, this concludes my role in your OSHA training. If you have additional questions, talk to your safety and health officer or reference your red OSHA Guard manual. If you haven't already, be sure to sign a training record to document your participation. Stay safe.